There's a number of reasons that restoration healthcare and most wellness practices do not take insurance. The first reason is that insurance dictates what you can and can't do for the patient. So essentially it limits care. You can have this study, you can't have this study. That's very frustrating. The doctor wants to do what the doctor is trained to do, which is care for the patient. So it limits care. The second reason we choose not to take insurance is because it limits the time that you have to spend. The only way somebody can stay in business in our traditional healthcare model by billing insurance is to see volume, multiple patients, 10 an hour, 10 minutes per patient. Well, you cannot get to the root cause of somebody's problem by spending 10 minutes with them. You need to spend extended time. So in a way, when you pay out of pocket, you're paying for an extended time to spend with the doctor so that they can really hear what your problems are and develop a plan. So this is not just symptom management. This is finding the root cause, and quite frankly, that takes time. I think that health insurance requires a perspective shift. The way we think about health insurance really requires a perspective shift. So health insurance, the way it should be looked at in this country, is essentially as it's for crisis care, right? It should be for catastrophic events that we hope you can avoid, right, by taking care of yourself. We should really think of our health care or our health insurance as like our car insurance, right? When you pay your car insurance, car insurance doesn't pay for oil changes. It doesn't pay for tire rotations, right? It just pays for the catastrophic, car accident, your car's totaled or whatever. So you don't really want to have to use your car insurance. Similarly, life insurance. Nobody wants to have to use their life insurance. That means you died, right? So it's just there in case. That's the way health insurance should be looked at, right? Health insurance is not, doctor, give me a pill for my symptom. If you want to stay in that stuck model, then sure, stay in the health insurance model, but that's all it can do for you. The current model of care cannot get you well. So our goal is to find the root cause of your problem and get you well. And that really takes time and energy and effort. In life, right, we all know that you sort of get what you pay for, right? If you're not paying for much, then you're not getting much. And that is our current healthcare model. So as a perspective shift, we should consider our health insurance to be for catastrophic care. And we should spend our own money on trying to keep ourselves healthy. Now, whenever you spend money on something, anything, you have some skin in the game, right? You've put money down and said, I'm gonna do this. So you're far more likely to follow through with whatever it is you're supposed to do as far as wellness is concerned if you have some skin in the game. And I think there's a huge amount of benefit. Nobody wants to part with their money, but I think it's a lot better to spend your money on getting well and maintaining wellness than it is to spend your money on health insurance that isn't doing anything for you. I'm not saying abandon your health insurance. I'm saying have it for catastrophic care and spend your money the things that you know are going to keep you well. So, the number one cause of bankruptcy in America is actually medical bills, and that is in an insured population of people. So really, our health insurance isn't doing anything for us to keep us out of medical bills that cause bankruptcy. It's a sham. The system is a sham. So don't fall for it. Most diabetic patients pay on average about $8,000 out of their pocket a year for their prescription medications. You'd be better off taking that $8,000 and working with somebody for 6 months on how to get rid of your type 2 diabetes. That's like making money. So then you don't need any of those medications. That's like essentially you have $8,000 every year after that going forward because you don't have to spend money on those medications. And really, take a minute and think about, what is your health worth to you, right? If you're a type 2 diabetic, of course, you know then you're, for example, at risk for losing a limb, right? It's one of the most common reasons people get amputations. So if I told you that losing a foot costs $14,000, losing a leg costs $38,000, but if I told you, don't worry about it, your insurance will cover that. And in the same breath said, but if you don't want your foot or your leg cut off, I have this great way that you can take that $14,000 or $38,000 and you can invest it in a way that will help you keep your foot so you don't have to lose the foot. But the bad news is your insurance doesn't cover it. So you'd have to come up with that exorbitant sum of money. You best bet the majority of people would come up with that money because nobody wants to lose a limb. And that's really the reality that we're looking at, right? So you have to decide for yourself, what is your health worth?